Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair, hair loss, or insulin resistance, you might be dealing with PCOS, or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created OV, a science-backed alternative to prescription medications. OV is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. OV offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to OV.com. That's OVII.com and start today.
Guys, I have to tell you about this amazing new podcast by the pioneer of conscious parenting, New York Times bestselling author, clinical psychologist, and Oprah's favorite parenting expert, Dr. Shefali. It's called Parenting and You. This is not your typical parenting podcast. Dr. Shefali talks to real parents in real time and helps them tackle their everyday parenting challenges using conscious strategies to raise empowered and resilient children. She helps parents overcome obstacles that get in the way of creating authentic connections with their kids. No matter what struggles you have, you will receive profound wisdom that will resonate deeply with your own life experiences. I highly recommend Parenting and You with Dr. Shefali on Apple, Spotify, or wherever you listen to your podcast. Hi, I'm Mary Alice Haney.
And I'm Dr. Thaïs Aliabadi.
Today, we are honored to have Taylor Odlozil on the podcast. Taylor is a father and widower who went viral for documenting his wife's battle with ovarian cancer on TikTok. His wife, Haley, was diagnosed with an aggressive form of stage 3C ovarian cancer at the age of 22. Tragically, Haley passed away from ovarian cancer in July of 2023 at the age of 30.
We also have GYN oncologist Dr. Kristin Taylor joining us to share her medical expertise on ovarian cancer.
This conversation is truly incredible. You're not going to want to miss this episode of SheMD. Taylor and Dr. Taylor. We're going to make sure that we're saying Dr. Taylor and Taylor during this so that everybody's clear on that. We're just so thankful and blessed to have you guys on the podcast today talking about your story and educating women on ovarian cancer. So Taylor, I think let's just start at the beginning. I have seen your love story, as so many people on TikTok and Instagram. Kind of tell us about how you guys met and her cancer diagnosis, and just let's dig into it.
All right, well, I'll start from the beginning. So I met Haley when we were in high school. I just finished my sophomore year. She'd finished her freshman year. And I was at a end of the year baseball party at a buddy of mine, and we were playing pickup baseball in the street, and I see this beautiful woman arrive. She's wearing, I still remember, she had a black bathing suit on with a black cover up. And I immediately was like, I want to talk to that girl. And I just thought she was so beautiful. And turns out she saw me and was interested as well. As time went on, I just knew that she was the one for me. And I would say within a year of us meeting in 2008, she started, asking me, to feel on her stomach. Do you feel a lump here? And I just, like most people do, oh, you're worried about nothing. Like, you're okay.
How old is she at this point?
Let's see, that was the end of her freshman year. So yeah. But she was not saying that that's what was going on was the cancer already, but she was already experiencing something that didn't feel right. She would have constipation issues, and as time went on, she started going to the gynecologist once a year just to be safe. And she would tell, I feel like I'm bloated, I feel like something's in there, and each year she would complain more and more because I guess it was getting worse over time. And she would ask, can we do an ultrasound or something? I just want to see what's in there. And gynecologists would just kind of say, oh, you're young, probably just an ovarian cyst, or it'll go away, the usual stuff.
Did she have painful periods too, or no?
I do remember her getting on birth control and to regulate her periods or something, but she was never a really unhealthy person, like pretty active and ate pretty healthy, and so she was slowly gaining weight, and then I proposed to her in 2014 December, and of course, she was so ready to get engaged, obviously, by that time, because we had been together, let's see, 6 years at that point. And so immediately began planning her dream wedding. And so she kind of was like, I want to get in really good shape. I want to look good in my wedding dress. So she, I think around, I would say September of 2015, she started working with a personal trainer. She shows up for her first training session, and the woman's like, oh, I'm going to get you where you want to be. Like, I'll have very successful clients. And she does her first workout with Haley, and Haley called me. I had to come get her from the gym because she literally passed out. And the personal trainer said, we didn't even do a really hard workout. Like, it really scared the personal trainer. And Haley just said, I'm just so out of shape that's why I did it. So she, kept going to that trainer, and they were kind of easing her into it. And over 2 months, they're doing a checkup on the weight and all that, and she was gaining. And then the personal trainer was like, I've never experienced this with a client of mine where they're not improving. And, Haley was telling her what she was eating every day. Like, she should not have been gaining weight. And so by December of 2015, she looked, I'm not kidding you, 6 months pregnant. Like, she had stretch marks up her belly, and she was having just issues we couldn't understand, like, and we thought they were like hormonal or like, hyperthyroid or something like that. And so she had been to the gynecologist in 2015, I think twice already that year, because we were trying to get to the bottom of why she was having no energy, and just she would eat and then feel full really quickly, and just things that didn't make sense. And so we thought it was some issue with her hormones. So I remember sitting at the dinner table with her mom. She was at work, and I said, Simone, something is wrong. Like, I just know it in my gut. Something is terribly wrong, and I don't know how to help her. And she's like, I know, I'm trying to get to the bottom. Her mom was scheduling all these appointments, but really when she was seeing the stretch marks, she was like, what is going on? Like, I shouldn't be gaining weight like this. And so she finally went to the gynecologist again, and it just couldn't be ignored at that point. She finally did like an ultrasound just to see what was going on. And she said, okay, we need to get you a CT scan, because obviously she saw something in there. So
How old is she at this point?
She is 2015. That would make her 21 or 22 at that point. Yeah, 22.
That's crazy.
So.
And she had been asking, something's wrong, saying
to
her doctor.
Yeah, I mean, like, please, can we do some kind of scan? I just feel like something's in there. She said she would say, it feels like my insides are stretching and being ripped apart. That's what the feeling was to her.
And the doctors just were like, no, you're fine. It's all.
As far as I know, that's kind of like, she was trying to put Haley's mind at ease, like, oh, because when you're young like that, I get like why it gets brushed off, because you don't see it in young women like that. And so we do the CT scan. I'm at work, and she calls me, and she's just beside herself. And if you know anything about Haley and me, we want to be parents. Like, that was like what we wanted. We talked about it from literally the day we met. And so she calls me beside herself, and she's like, Taylor, the scan came back, and they're saying that there's some kind of mass in there, and I'm scared. And she's crying, and I'm a little scared, but I'm also under this mindset of like, this isn't happening to me. Like, everything's going to be fine. It's just going to be something minor. So I let my boss know, I need to go home. Got to go to this oncologist appointment because they booked her an appointment like immediately. So I get home and we go to the appointment, and it's me, her, and her mom. Her dad's like parking the car or something. I should have known when we checked in. I could tell by the looks of the faces of the women behind the desk that they like knew that something big was coming. We come in there and we're waiting, and like we're just sitting there silently, like my heart's like beating out of my chest. I'm freaking out. She's scared. And then doctor comes in and, with the folder, sits down, then looks up, and she's got tears coming down. And she doesn't even know Haley, but she knows what she's about to tell her. And she's like, I've been doing this a long time, and by the looks of your scan, you have ovarian cancer, and it's advanced. Haley's first words out of her mouth are, can I have children? Because that's all we cared about. She literally didn't even care about her health. She just wanted to know, can I have children? And she said, I don't know for a fact, but you need to worry about your health right now.
Your life.
Your life. Yeah, your life. And so we start sobbing. I'm crying, and then she tells us some more stuff, but to be honest, I didn't process a word. And she left the room, and that's when her dad walks in the room, and we're sobbing, and he's like, what's going on? What's wrong? And we tell him the news, and he's like, nope, that's not happening. Like, he just didn't believe it. And so then she kind of like told us what needed to happen, which was a biopsy to confirm her findings. Obviously, you can't confirm it from a scan, but she wanted to do a biopsy and see what was going on. So that was in with like 2 days or something. But we went home from that appointment distraught as you can imagine. And so we did the biopsy, and we still were holding on to hope that this could be something else. And the biopsy was like maybe 10 minutes, and she comes in and says, yep, it's cancer, ovarian, and it's everywhere. Her doctor woke Haley up from surgery. Haley told me this story. Haley kind of came to, and she was holding Haley's hand, and she was crying again. And she explained to her what she found, and she said, I'm going to do everything I can to help you. And that's when the connection between the two started, was that moment. So.
So,
my God, where do you go from?
I know. What was her diagnosis?
What she told us was serous carcinoma, stage 3C ovarian cancer. And it turned out that it was high and low grade, which apparently, from what I've heard, is extremely rare and just not seen very often.
So much of what you described resonates in terms of stories that I hear from patients all the time. So bloating, weight gain, especially in their belly. So people might be working out, they're gaining weight, and suddenly they're like, I'm not gaining weight anywhere but my belly, my pants don't fit anymore. It's kind of the same type of story time and time again. This kind of cancer, a lot of the symptoms are kind of vague. It can be indigestion, constipation, like you mentioned, getting full easily when you eat. A lot of things that can be transient due to any number of things. I ate a Big Mac and I shouldn't have, right? But things that persist over time for at least a couple of weeks, a couple of months, for years, as it was for Haley, really are telling of something else going on that we really need to get to the bottom of. So typically by the time people are having these kinds of symptoms, it is stage 3 or 4. So stage 3C is actually the most common stage that we see for ovarian cancer. The serous type is the most common type. Most people just have one specific type, so the high grade serous. A mix of low grade and high grade is really, really uncommon. And any of those in someone as young as Haley is even more uncommon. These particular subtypes really refer to sort of how and why the cancer became a cancer, how fast it grows, what kinds of treatments are effective. And low grade and high grade are opposites in a lot of ways. So the low grade is driven by certain kinds of genetics, and it grows a little more slowly and usually doesn't respond to our typical chemo. And high grade's sort of the opposite. So you're kind of working with two opposing things at once. So really, so many things that were challenging for Haley's case.
And it's rare for someone so young too, right?
Absolutely. The average age of diagnosis for any ovarian cancer is about 63. And again, most people have this high-grade serous type. So most women with that type are much older than Haley. Only about 5% of ovarian cancers are in women who are in their 20s, 30s, or younger. And those subtypes tend to not be like this. They tend to be coming from a different part of the ovary, diagnosed at an earlier stage. They look a lot different. So again, it speaks to a number of reasons why I understand people might not have suspected that all of Haley's symptoms were due to an advanced ovarian cancer. It's so unusual.
So what do you guys do? You get this, so then what's next? What happens next?
Within a few days, she had gotten a port put in, and we immediately went into chemo. I think it was carboplatin paclitaxel is the treatment she got.
This is before your wedding?
Yeah, so the night of the biopsy, I tell this story a lot because it speaks to who Haley is. When we finally got home, and it's been like 3 days since the original appointment, I'm scared, she's scared, and we're just exhausted at that point. And I help get her into bed, and I'm sitting on the side of the bed, and she rolls over, and she's got tears coming down, and she says, "I need to talk to you." I said, "What's up?" And she said, "I know what we're facing here, and you're young and you have a lot ahead of you and you have a bright future, and if you want to move on and marry someone else, I'm okay with that, and I release you if you want to go, and I'm going to give you nothing but a broken life if you stay with me." And she says, doctor's appointments, surgeries, heartache, like that's where we're headed. And it broke my heart for her. And it's not even in my DNA. I'm not a quitter. Like, I don't quit things. And I said, "Are you kidding me? Like, I'm not going anywhere. Like, we're riding this to the end, like whatever that is." And I just said, "I love you, and I don't ever want to hear you say that to me again. And I hope you'd be there if the roles were reversed." And she says, "You know I would." So, so that's a moment that sticks out in my mind. But so then she had the port, did the carboplatin paclitaxel, and it was every week for 9 weeks, and the 9th week ended up being the week of our wedding.
Dr. Taylor, can you tell us a little bit about that chemo, what it does to the body?
Yeah, absolutely.
What she was possibly experiencing?
Sure. That's sort of our tried and true carbotaxol, we say. So we have lots of experience with that. You don't feel great. We've gotten much better at drugs to help prevent nausea and vomiting, but people do feel pretty worn down, a little queasy. Some people can get some muscle, joint, bone aches. You feel a little bit flu-like, frankly, for probably 4 or 5 days afterwards. It's a little different for everybody. So I think doing that while planning a wedding, I truly can't imagine everything.
She was a warrior for sure, and so obviously she lost her hair within like a couple of weeks, or she refused to shave it, so we ended up finding it all over the house. And so then she finally was like, "Okay, I got to do it." And so she finally shaved her head, which was a very emotional moment for her, especially with the wedding coming. You can imagine a young woman looking forward to this day all her life. And so we got to the wedding, and they had to glue a wig on, and the steroids, that was what she hated the most, was the steroids, because it made her blow up. Like, face was swollen, her dress didn't fit anymore, so she had to get that altered. And so do the wedding, that went by in a flash because it was just an emotional day. And that Monday, or she had a scan that week after her last treatment to see the progress of the chemo. And the plan was to do the 9 weeks, scan, and then do surgery. That was the plan. And so Monday after the wedding, which was on a Saturday, we were supposed to get the results from that scan. So we all go to the doctor's office, the whole family. Everything we did was the family was together. And so she comes in and basically says there was no shrinkage. Like it grew like nothing. And, I could sense that, she was kind of wording things in a way that it just seemed like foreshadowing that something worse was coming, but she wasn't really saying it. And I asked to speak to her alone because I couldn't utter the words I wanted to in front of Haley. And I just looked at her and I said, "She's dying, isn't she?" And she said, "Yeah, she's got 6 months." She was comforting me because I was very distraught at that point. She never sugarcoated anything, which I respected about her, and I loved that, just shoot me straight from the beginning. And that's the way she was, and I loved that about her. And I said, "Well, you got to tell Haley because I can't do it." And she said, "Well, I want her to go enjoy her honeymoon with a free mind." And I remember, we got home, and I needed to let some things out, but I didn't want to scare her. And I said, "I need to go to my parents." So I'd go over, and I'm like banging on the door. My dad opens, and I literally fall into his arms in the doorway and like fall on the ground. I remember, I'm pretty stoic, but I was beside myself. Like my dad just was sitting there on the floor, like holding me while I was just sobbing. And
can you hold for a second?
Yeah.
Guys, we need some tissue for Dr. A. I mean, as a mom, I'm a mom.
Yeah.
I'm a mom of boys, and I honestly can't even imagine my son coming back to me and having to, go through that at your,
That's a day that I like to say chipped a nick off my heart.
Yeah.
Like you have these moments in your life that I think really start to mold and shape you and change you forever. And that was a day that changed me.
Yeah.
And I stayed at my parents' for about an hour and a half until I was able to calm down. And came home, and she was laying on the couch, and we laid together for a few hours and cried. And then we woke up the next day and gathered ourselves and started packing for our honeymoon, and we ended up going to Oahu. Okay. So that was a lot of fun. But when we came back, that's when we talked to her doctor, and she basically said, "Okay, I've got a plan for you. I think it's worth a shot." And that was to see the surgeon Dennis Chi up at Sloan Kettering, and he's a legend.
He's a legend.
Know him.
He is. I mean, I call him a badass, so that's what I call him. I mean, he's
he did her surgery.
Yeah, so she said there's a surgeon in New York that I really think can operate on you and change a lot of things for you.
Because at this point she's been given 6 months.
Yeah, but she doesn't even know that.
She doesn't know that.
So we hear about this guy, Dr. Chi, and so we get an appointment, and we fly to New York pretty quickly to talk to him. He comes in, and one thing that stuck out about him was how compassionate he was. You feel like he actually cares, like he's truly trying to help and loves what he does. But he agreed to operate, and he said, if you were a lot older than you are, I would not attempt this surgery. I don't think it would benefit your health at all. It's going to be major surgery. And so I think we flew back in a few weeks, did the surgery, and I remember saying goodbye to her when they took her back, because there was a high chance that she could probably pass away on the table. And so I just 3 weeks ago I just got married, and now I'm saying goodbye, that she could die. That was another day that stuck out in my mind, of saying my goodbyes to her and not knowing the outcome. So they take her back, and 1 hour turns into 2, turns into 3, and they keep coming out and giving us updates. So then hour 9 approaches. I mean, that's a long day. And so he calls us back to the conference room. He comes in, and it's just like another day of work for him. All right, so I took this out and that and this and that. And yeah, it was a successful surgery. And I was like, so you got the cancer? He's like, oh, 100% of visible cancer is removed. And we were like, excuse me? He was like, yes, I was able to get 100% of visible cancer. That doesn't mean she's cancer free. She needs to get into treatment as soon as possible. And he said the recovery from this surgery is a life-altering surgery. I need her in the hospital for 3 more weeks, and then it's going to be at least a year before she even feels normal again.
Did she have a colostomy bag?
Oh, that was another thing. He was fully expecting, and we were, that she was going to come out with a colostomy bag. Like, from the looks of the scan, you can only tell so much from the scan, but there's one area that he was really concerned about. And so he had a colon doctor in there ready to go. Well, the amount that they removed from the colon was just under the limit of so they could put it back together. And so she didn't have a colostomy bag.
Dr. Taylor, ovarian cancer 3C. Can you tell us about that stage? Like, where is it in the abdomen? Can you just explain it to our audience?
So stage 3C essentially means it's moved above the hip bones inside the abdomen. So often there are little tumors scattered throughout the cavity. They might be sitting on different parts of the intestine, maybe on the surface of the liver, around the surface of the spleen, those kinds of places. So it makes a lot of sense hearing the extent of surgery that Haley had to have with stage 3C.
Mm-hmm.
And I have another question, and it might be going on a tangent, but I've been working with this oncologist in San Diego, Dr. Lowy, and he's one of the first surgeons, I think, in the country who years ago started doing HIPEC for appendix cancer. Mm-hmm. And a few years ago, they started the treatment for ovarian cancer limited to the peritoneal cavity, so limited to the abdomen, without having gone inside the liver or elsewhere in the body. At the time of surgery and removal of the tumor, they basically pour hot chemo inside the abdomen for about an hour. It has a high mortality rate, but when it works, it really does. And I learned about it years ago from a patient of mine who had recurrence of colon cancer. And at my institution, she was given a year to live, and she was told to go back to Israel and be with her family. And because she was 63, just like your father-in-law, I said, there's no way, Yafa, I'm going to let this happen to you. We're going to go knock on every door. And one of the doors I knocked on was Dr. Lowy. And he said, well, she has 1 year to live. Send her to me. Let me see her. This was about 9 years ago. So he actually called me back and he said, she's a good candidate for HIPEC. It's limited to her abdomen. The tumor was not resected at my institution because they said it's non-resectable. It was only 7 centimeters. So he took her back, did surgery, removed the tumor, did HIPEC on her. 10%, she was quoted 10% mortality rate, 40% cure. And she was in the hospital for 3 weeks because it's an extremely dangerous, long, and traumatic surgery. But I saw her in my office maybe a month and a half ago. She still comes for her annual exam. So listening to his story, I wonder, do we have studies on ovarian cancer and HIPEC? Could they have done HIPEC on her at the time of this surgery? Or we need more information?
Yeah, that's a great question. So there are studies for patients just like Haley who have what we call neoadjuvant chemotherapy, which just means getting chemo first, hoping to shrink things down enough so that you have a successful surgery where you get everything out or leave nothing bigger than about a centimeter. It's called an optimal tumor debulking. So that's sort of the goal. So for people who get chemo and then surgery, if at the time of surgery you get everything out, they are a candidate for this HIPEC chemotherapy. There was a big study published showing that it does make people live longer on average. That study was done in Europe. In practice in the US, we've seen mixed results. So we're actually repeating that study. So it's a little mixed. Some people offer it, some don't. So I think the question still stands. Are there certain people who benefit? And maybe we don't know how to choose those people.
And she had chemo before the surgery, but it didn't shrink it, correct?
Yeah, she, it goes back to the high and low grade. And I think she might have had a majority of low grade. Mm-hmm. I think there were portions of the tumor, from what I remember, did shrink, but it was like not very much, or it stayed the same. So that's the problem with her treatment for the last 8 years was we would hit it with chemotherapy, which hits the high grade, and then the low grade would grow, and then we would treat her with hormone or surgery to get the low grade, and then the high grade would grow. Oh my
goodness.
That's why it's bad to have both.
And you said she wanted quantity over quality. So can you kind of talk about then your journey, and also you guys did have this beautiful little boy, and I know a friend of yours was the surrogate, and I'd love to talk about that.
So the biggest thing for her was she just loved life, and she was in this mindset of like, I don't care how bad my quality is, I just want to be here. I want to be around. And I just thought that was amazing, love for life. And so after the surgery, she, it was a long recovery, and it definitely affected our day-to-day. Her energy was not like it was. She'd get tired. And then she started menopause at 23 years old. And those hot flashes are no joke. I mean,
they're not,
especially at 23.
I mean,
I can't imagine.
We would just be driving down the road, and she'd be like, turn the AC on. Like, and I'm like,
that's me.
She just gets so mad, and I'm like, whoa, So she was dealing with menopause, and also, I would say she had a little bit of mourning. We both did, on the ability that even though we knew we couldn't have kids, but to officially not have a uterus or ovaries, I mean, she was mourning that loss. That's a major thing, and that was hard. I always thought I was going to be a dad, and we were in that tough spot of we may not be parents after all, which she was born to be a mom. I just can't express it enough. And so we went on with our different mindset. That was, after that traumatic year, that's when I started to learn. I used to always stress out about the future, what's coming up, I don't look past today now. I just have learned that today is a gift, and we're not going to get stressed out about tomorrow because it's today. And so that was a lesson I learned early. And it's really the only way you can live normally when you're dealing with cancer. Because if you're not present in the moment, you can't experience joy. If you're worried about a diagnosis that might get worse down the road or scans coming up, you just can't function. It's debilitating. And so I always like to say, be where your feet are, be present. And so that's the way we kind of lived. And she was on hormone therapy. I tried to remember, I think one of the treatments starts with an L.
Letrozole. Yep.
That's it. She was on that for a little bit. I think that was the one that made her ankles hurt really bad, her bones. I mean, serious bone pain.
Yeah, some people can't stay on it.
It was like awful for her. And so she did that for a while, and we were trying to determine what she could take to just keep the cancer at bay. And so we would find something that worked for a while, and it seemed like cancer gets smart or something and changes how it's reacting, and then you got to change up treatment. So we were constantly changing treatments, but we got to a point where it had been like over a year, and everything had stayed pretty stable. And we're talking about tiny tumors at this point. They weren't like massive. They were just tiny little tumors, little nodules that were growing. And that's when Haley's like, well, I want to have a child, and on our wedding night, a family friend of ours, Jacqueline, Haley nannied for her child, her and her husband's child, at like 2 weeks old or something. And that was when I really got to see Haley like be a mom kind of, and it was just beautiful. And this was all before the diagnosis. And so Jacqueline and her husband saw what a great mom she could be. So when the diagnosis happened, they were devastated for her. And so on our wedding night, Jacqueline came up to Haley and I and said, if you're ever in a place to have children, I would love to be your surrogate.
Oh, I know.
And I just was like, couldn't believe it. And so her doctor said, you're in a good place if you want to move forward with trying to, from what everything looked like, she had a good amount of time. And so we felt that it was okay to bring a child into this, and that, hey, I wanted Haley to be a mom, but I also had some reservations of, like, I knew Haley was not going to be healed of this. It was just never going to go away, and that I will probably be a single dad at some point if we have him. So there was a lot on my mind too, but we started moving forward, and we did the IVF, the egg donor thing, and I always wanted a boy and she always wanted a girl. So we decided whatever the healthiest embryo was, that's what we were going to implant. So we get there and with the doctor. He's like, all right, we got 10 or 11 great embryos, and I've got them ranked healthiest to least. And so I'm standing against the wall, and I got my head down, and he's, all right, so what do we transplant? And I'm ready for her to be like, all right, we're doing the girl. And she goes, I want to do the boy. Like, decides in the appointment. And I look up and I'm like, what? And she, with tears in her eyes, she said, I can't give you children, but I can give you your boy.
Oh.
And it
what
gets
a
to me.
sweetheart. What an angel.
I'm telling you, she's the greatest woman ever. So basically they implant and it goes perfectly. And in January of 2019, we have little Weston. And he was 8 pounds, 7 ounces, like healthy. And just, it was an incredible experience. And Haley was actually helped deliver the baby and deliver Weston. And that I caught on camera, which is a very powerful shot of her reaction to that. You can just see how badly she wanted that. And so,
how was her health at this point?
It was good at that point. Everything was, we were keeping everything at bay, which is what I knew we would be doing our whole life. It wasn't just going to ever go away.
Hello, listeners. Mary Alice here to talk about why I love this episode's sponsor, Medicaid. Medicaid is a clinically proven British skincare brand known for age-defying results. I'm obsessed with their liquid peptides, as are so many others, because it's one of their best-selling products. It's formulated with 10 powerful peptides in just one bottle. It's so important to be as proactive as possible to keep your skin looking healthy and fresh. Liquid peptides reduce the appearance of expression lines and deep-set wrinkles. Do I have a few of those? Yes, I do. But now I'm able to smooth the look of fine lines and wrinkles. I put it on in the morning so my skin is nice and hydrated. And the peptides do their work to target aging with dermatologist-recommended liquid peptides. All Medicaid products undergo clinical testing, which we all want, right? Trust me when I say I have tried a lot of different products throughout the years. If you're looking for something that actually works, go get Medicaid liquid peptides. I think you'll love it as much as I do. Here's what you need to do. Visit Medicaid.us for 20% off your first order with code SHEMD at checkout. That's MEDIK, 8.US, and code SHEMD to save 20% off your first order. Hi guys, it's Mary Alice here with a message from this episode's sponsor. I wish I could spend every day at the beach, but there's truly nothing better than the smell of the fresh ocean breeze on a hot day. Recently, I've been using Osea's Undaria Algae Body Oil. That brings that feeling right into my daily routine. And you guys, I'm obsessed. I literally get out of the shower and I slather that oil all over me. I'm always looking for ways to keep my skin looking fresh and young. And Osea's Undaria Algae Body Oil is proven to instantly improve skin's elasticity and deeply moisturize. I'm serious. I've been putting it on every day after the shower, and I've noticed a huge difference in the texture of my skin. I love that knowing Osea's products are clean, vegan, cruelty-free, and climate-neutral certified. And I absolutely love that Osea is a woman-founded and led company that has been making seaweed-infused skincare for over 28 years. Get healthy, glowing skin for summer with clean, vegan skin and body care from Osea. Get 10% off your first order site-wide with code GYMD at OseaMalibu.com. You'll get free samples with every order and free shipping on orders over $60. Head to OSEAMalibu.com and use code GYMD for 10% off.
And so at that point, I think like within a couple months of him being born, we started having issues again. We saw a big uptick in growth. She definitely had a different mentality this time. We started doing this thing where we would give ourselves a certain amount of time to cry and be upset. And then after that time was up, we had to, strap up our boots and move forward.
And you have a baby,
Yeah.
and you have a little boy. And so how was that? How was Haley deal? When she started to get sicker and sicker, how did you guys deal with Weston, and how did you talk to Weston about it?
So since his birth, all he's ever known was that mommy was sick, and that mommy was a little different than other mommies, couldn't do quite the same things, but she did her best to do as much as she could. And we never sugarcoated anything with him, because I knew that his life was going to be more difficult, and that life is not easy. It's not fair. And I'm not doing my job as a husband and a father if I'm not preparing him to be strong. And, I always told him, here's where we are with mommy. She's got cancer. I never spelled anything out. Like, this is the way it is, son. Like, and our job is to take care of her.
And you started documenting this whole journey, which is how we found you. And honestly, some of those videos of Weston with her and their interaction are some of the most powerful things I think I've ever seen. Just that love that you could so see from her and Weston together. I mean, it really is just kind of.
And I'm so glad she experienced it.
Yeah.
Do you know what I'm saying?
Oh,
a lot of women come through, they go through life and don't have that need. And it was so beautiful. I watched a couple of them. My oldest daughter was following, I think both of my daughters, your journey. And I remember the day she passed, she came to my room and she was bawling her eyes out.
Oh, wow.
And that's how I learned about you and your journey. And I mean, my children were devastated, not even knowing you. And one day she came to me, she's like, Mommy, he has to come on your podcast. You have to bring awareness to ovarian cancer because people need to know.
Honestly, what you and Haley did by documenting that, which could not have been easy. It could not have been easy, is going to really help so many women and husbands and children that are all going through this. So can you talk about sort of, she kept getting sicker and you guys knew and sort of,
So 2021, that was when she had, I think 21 or 22. It all runs together. She ended up getting a blockage, and that almost killed her. She had to have emergency surgery and ended up with a colostomy bag after that. That was a major setback for us.
Dr. Taylor, I'm sure you see this every single day. It's so traumatizing for us to listen to this, but this is what you do every day. How do you cope with that? I'm sitting here listening to his story. I have stomachache, I'm nauseous, I'm emotional, I'm anxious. How do you do this every day?
That's a great question. I don't have any magic formula, honestly. I mean, I'm getting choked up hearing this story. I feel and resonate with all my patients, even though I haven't gone through this personally. It's still hard. I think kind of like what you said, have a brave face and try to be that person that your patients need you to be. One of the things I like to do when I'm meeting someone with a probable or certainly a new cancer diagnosis when they come to meet me, kind of like what you said, when you walked in, you see people who don't have hair and it kind of starts to hit you. Oh my goodness, I'm in a cancer center because that's affecting our lives. We sit down, I say, I'm Dr. Taylor, nice to meet you. I'm sorry you have to meet the oncologist today. No one ever wants to. And I just pause because I think sort of leveling together and just recognizing that you really don't want to be here, right? But you have to be, and I recognize that, and we're in this together as much as I possibly can be. And I think just, getting to know my patients and their families and just being who they need me to be. My love for the science and medicine, sort of turning all that into, what's helpful to you. I think just trying to be utilitarian, honestly, and really focusing on that part when I'm with patients. But certainly at the end of the day, it weighs on me for sure. So I exercise, I meditate, I do things to try to, stay strong and balanced. But I cry, it's hard. It's really hard. So I'm certainly not numb to it.
I'll definitely say that Haley's doctor and Haley, they've had a good, close bond. And she admitted to me that, typically you got to put up a wall with your patients because if you get too attached, it's painful. But it's hard not to because you care. She said Haley got in my heart, and I let her in. And I think it to this day, it's been the toughest for her. It was October of 2022. So 2 years with the colostomy bag, adjusting to that. She started having issues. She wasn't having very much output in her bag. And she was throwing up, which is a sign of blockage. I said, we need to get this checked out. And so sure enough, she had a minor blockage. And at this point, with the major surgery that she had had and the location of where these tumors were, it was super high risk to operate. And the doctor was explaining if we do treatments or anything, there's a chance that we could lacerate the blockage, and that would be a very traumatic death. And so we went into this appointment like just thinking it was a checkup, and then we find out that we're down to 3 options: risky surgery, risky treatment, or go live our life. And we were just like not expecting that, me and her. And
how old's the baby at this point?
He's 3.5. So Haley was like, wait a minute, like we're not out of options, are we? Because there was many times where we thought we were, and then we would come up with something that would work. And so like we never really believed it. And so, but I remember a doctor taking her by the hand, and she started tearing up, and she said, you need to prepare that this is your last Christmas. And we just couldn't believe what we heard. And so we went over to my parents' house, and she had a big cry, and I cried, and we just kind of tried to process it. It's like I knew that one day it was coming, and then when it came, I almost didn't believe it, if that makes sense. And so I was kind of in shock, like this isn't happening. And so in the next few weeks, we were having all these appointments trying to figure out, are we going to actually try and do a surgery? Are we going to, so it took a while, but middle of November, we finally was like, all right, hands off the wheel. Here we go. I made a video and I put it up on Thanksgiving Day, and next thing I know, it was just everywhere. And everyone started following me, which I thought was weird because I didn't really have anything to follow. And then 2 days later, I posted another little short clip of Haley and Weston laying in bed, and she was saying, when you don't hear me or feel me, where am I? And he said, in my heart. Oh. And it was like 20 seconds long. I put that up, and then that one went more viral than the first one. And then before I knew it, I had like 200,000 followers. And then I sat down with Haley, and I said, Haley, we talk about this all the time, that we walk around and people just don't realize how blessed they are in the life that they have. And that they look at life such a wrong way. I was like, this is what we've been waiting for, to share this powerful love story that, we truly love each other, and we want people to value love and experiences and be where their feet are, and be with their families, be with the people they love. Like, do you want to share more and like help more people? And so we decided that we were going to do it. And none of my stuff was ever like planned out. It would just like, I would just hold my phone and it would just happen in front of me, and I would just catch these raw moments. It just started blowing up like crazy after that. And that's when she went on hospice in January of 2023. I think that's when she officially went on. And it just, by the weeks going by, her health, you could just see it starting to deteriorate. And her dad was like, whatever we want to do as a family, whatever you want, we're going to do it. And so she was like, I want to go to Rosemary Beach. So we went there, and we have relatives from different parts, and they all flew in, and we had this like last kind of like family vacation on the beach. And
is that the one where everyone was telling her goodbye?
Yeah, there's a video of her. I just caught it on camera, and I debated sharing that or not. So I made the video, and I had it in my drafts, and we went to dinner the last night, and I was talking to my brother-in-law, and I said, I'm still debating, but I think I have a video that's going to like be massively impact everybody. And he was like, let's do it. So I went live with it. Oh my gosh.
Tell everybody what the video was.
It was a video of Haley's cousin. Haley was laying in like a hammock thing, and they were getting ready to leave to go back to Alabama. And I thought that was going to be the last time they were going to see each other. And she just was saying goodbye and kissing on her hands and face, and it's just so raw. It is a raw video. I mean, you can just see the emotion, the love. But yeah, I posted it, and I had never seen anything. I think it had 1 million views in 10 minutes.
And how, from that point on, how long was it till she passed?
She passed July 14th. So, I mean, she just kept fighting. I'm telling you.
How did you prepare Weston?
Anytime we told him from the very beginning, we said, Mommy's at a point where we can't help her much. Only thing we can do is help her, make her happy. We can't really help her health, but we can make her smile and laugh. And that's going to be our job, Weston. And it's like, okay. He's like, okay, Dad. And I said, we just got to be our best to be the happiest we can around Mommy so she's happy. And so I'd explain it. And then, days later, is Mommy going to heaven? I said, of course she's going. I don't know when, but she's definitely going to heaven. And so he would ask periodically. We would never, if he was in the room and we were talking about Haley, we wouldn't like spell out the word die or anything. And he was such a good caregiver too, and he just would love on his mom. He's so loving. But he definitely knew what was coming, and Haley's hospice nurse, Marcy, she was been a part of the whole journey, from the beginning, and was just such a comfort for Haley, and would come over and have these deep conversations, because Haley was scared. I mean, you can imagine being young like that, and you're kind of the first of your age group to go. That can be scary, and so she would come and spend time with Haley and talk with her, and she was just a great hospice nurse. So I've experienced all the different levels of healthcare and what is needed at each stage. And, when I was saying hospice is also a beautiful journey, at the beginning of hospice, Haley said this comment, I wish I could just take that drink in Oregon and be done. Like there's some kind of thing you can, because I know the suffering that's ahead of me, and I just want to go on my terms. And at the time I understood what she meant, and I get it. But then after we went through, all that hospice journey and all the experiences we went on, we realized that we would not have had all the deep conversations, and the people that came over and held her hand and told her how important she was to them, and just all the things they were thankful for getting to know her. And you miss out on these very intimate moments if if she would have gone that other route, right? And so we just saw the beauty of what hospice did provide in that sense, and our love definitely grew, and it just made it even harder at the end. But when you're at the lowest low and you're leaning on each other, your bond strengthens. And So, but to get back towards the end, she was struggling that morning, and I took her to the bathroom, and she couldn't go to the bathroom, and I got her up, put her in her wheelchair, and she kind of had this like episode that lasted about 15 seconds. And I texted a video of it to Marcy, because I was like, what do I do? Like, what's going on? And she basically said, she's close, I'm on my way. So I wheel her into the living room, and I scoop her up, and she just like goes limp. And I'm like screaming out to God, don't take her this way. I can't do this. Like, because I thought she literally was dying in front of me, and I'm holding her, and then Weston hears, and he runs in, and he's seeing his father like very upset, crying, yelling out, and I'm telling him, go back to your room. I didn't want him to see any of that, and I put her back in her chair, and she like just goes like totally lucent again, like, and it's just like, what's wrong? Why are you crying? I was like, oh, do you know what just happened? And she was like, I've just been in my chair all morning. And so she had this weird episode anyway, and that's when I realized we were there, and she had no memory of going to the bathroom or nothing. And so Marcy gets there, and her parents were on their way, and Weston, we took him to a science camp that he was signed up for, so he wasn't there at the house. And then our pastor came, and she had always said, I want to die in my chair surrounded by the people I love. So she's in the chair, and we're all surrounding her, and she kind of comes to, and she's seeing all the people she loves, and she's in her chair, and she's like, this is it, isn't it? This is the end. Like she's like realizing this is it. And then she starts, getting scared. And so Marcy was like, we don't want her getting upset. And so we give her some anxiety medicine, calms her down, makes her a little more sleepy. Then I realized that if she was about to slip into that coma sleep state, I needed to go get Weston immediately. Mm-hmm. Weston came back, and everyone stepped out. And that was when that was the last time he was with his mom. And I explained what was about to happen. And I just, he was sitting in a chair in front of me, and we were sitting by her chair. And I was just looking in his eyes, and I said, do you understand what's going on? And he was just kind of had this like look of like he did, but didn't want to say. Mm-hmm. And I said, how you always ask about mommy going to heaven? He said, yeah. I said, well, it's about to happen. He was like, now? And I was like, no, I don't know now, but it's any moment. Mm-hmm. And I said, I just want you to understand, son, that your mother and I are proud of you, of everything you've done. You've been a great son to your mom and taken care of her. She is not going to heaven because of you. Like, mm-hmm. She's here because of you. She's made it this far because of you. And I don't want you to ever blame yourself for anything that is happening. And I said, I'm going to need you, and you're going to need me, and we're going to have to be a team on this. Mm-hmm. And obviously I was crying a lot more, but I've told the story so many times that I've just processed it. But we were holding her hand, and he doesn't fully quite grasp what's happening. And he's just listening to me. And I said, you want to give mommy a kiss? And he climbed up, and he gave her a kiss, and she came to, and she said, I love you, Weston. And he said, I love you, mommy. And that was the last thing she ever said. She went into her coma state within 10 minutes of that, and never came out of that. And
then she died peacefully.
Yeah, she ended up dying 2 days later. But my parents took Weston because after she slipped into the coma state, everybody, because we have a lot of friends, mm-hmm. We've been in that community a long time. It was just people were coming in mm-hmm. to say their goodbyes and spend a little time with her. And her sister was really great because we had to give her morphine every like 4 hours because you don't want them to be in pain at that point. That's when it gets traumatic. And so, to be honest, I'm really thankful how it went towards the end, because she was just asleep. And I just saw people that I've been friends with a long time come and say goodbyes and spill their soul out. That really touched me, and realized how important she was to all of them. I had spent most of the night laying with her. I had laid out these chairs from the dining room table so I could lay next to her in the chair. And we watched Home Alone, which was her favorite movie. And I just laid with her. And I got into bed pretty late, and then I was up and down all night because I couldn't really sleep that well. But then I got woken up about 6 a.m. by her sister saying, "You got to come quick, her breathing's changing." So I jump up and I sit next to her, and I'm holding her hand. And she's taking these deep breaths. And then she just takes in this deep breath and just lets out this big sigh. And that was it. And it felt like someone reached into my body when she took her last breath and like took something with me, like something left my body that I'll never get back. That's what it felt like. And I was, like I said, I'm a spiritual person, and I've been reading this book, Imagine Heaven, and there's like over 1,000 NDEs, near-death experiences in there, and they talk about how they experience going to the ceiling a little bit, and they can look down, and then they keep going. And that's what they. And so when she passed, I just kind of looked up and blew her a kiss, because I knew she could see, and I just remember sobbing. Like I had never experienced like physical heart pain, like where your heart actually like hurts. Like it's breaking. And I just laid on her and sobbed and cried, and then I made all the phone calls, called up Marcy, she's gone, called my best friends, she's gone, my parents. I felt like I blinked my eyes and there was 20 people in my house. Everybody was there. And Marcy, it took her about a little over an hour because she lives kind of far. And she gets there and she says, I need you to do one more really tough thing. And I know you've done a lot, and you've been doing this a long time. And I need you to carry Haley to the bedroom, because I need to clean her up and so people can spend some time with her. She was like, I can get somebody else. I said, no, I can do it. It's my job. I'm here to do it. Like, let's do it. So we go in the house, and everyone steps to the backyard, and they're, I've got 2 big bay windows by the chair so you can see into the living room pretty easily. And everyone steps out to give me some time with her, and I pick her up, and obviously at that point had been deceased over an hour, so she was very cold and not, organically in my arms, which just, it's like an image I can't forget. My friends are processing losing a dear friend and watching another friend having to deal with that loss. And I'm carrying her, and I just look out, and everyone's just silently like breaking, because just the image of me carrying her, that really impacted them. I go in our bedroom and I set her down, and I just had this weird like out of body experience where like the last 8 years of my life like flashed before me in like a second, because being a caregiver is not easy. And I knew what I was signing up for. I knew the road I was headed down. And it was like this weird, like, especially the last few months were very traumatic. All the things I saw and had to do, and all the goodbyes I said, and the deep conversations. And it just all kind of flashed through my mind that like everything that I had played out in my mind has now transpired. That was my last 1% of my energy that I could give her, was to carry her. I am thankful that I got to be the one to do it, and I was honored, and she changed my life forever. And
she also, I know, said to you numerous times that she didn't want you to be alone.
No, she did not. She always, said, I want you to find happiness, and but she was always really funny about it. She was like, I want you to find happiness. I want Weston to have a mom, but the thought of you with someone else makes me want to puke. Because I mean, we were together since we were 15. I mean, that's all we knew. We never dated. We literally met, and that was it.
But how do you feel today, sitting here?
Honestly, I used to be angry, but I would say today I'm very grateful. I have a sense of gratitude that's really hard to explain. I'm grateful that she taught me so many things, molded me in a certain way that I look at life very differently than most people. If you don't believe there's a greater plan or purpose, I don't know what to tell you, because it happened to me. I just never dreamed I'd be where I'm at now with being able to inspire other people and have a platform. And so I feel like I've been reborn with this purpose, and I love to inspire others and affect their perspective and make them appreciative of the life that they have. And
that's incredible.
So that's why I say I'm in a sense of gratitude. I have moments where I get sad that it had to happen, because she really was so perfect for me. You literally you develop one life when it's a high school sweetheart, because you're still so young. And so losing her was like I lost a part of me. I call them grief relapses, where like I'm fine for like a couple weeks, and then I just have a day where it's like it all happened again.
I was diagnosed with breast cancer 5 years ago. So I relate to your story, especially when you have children. But one thing, I read a book, a friend of mine gave me a book, and basically the summary of it is, when something traumatic happens to you in life, instead of saying, why me? Why did it happen to me? There are all these people on the planet. How come it's not happening to them? Go down that path and you'll see why you were placed on that path.
That's
I remember I finished listening to this book because I was too sick to read. And I sat on my bed and I told myself, this happened to me so I can change the world of breast cancer. I will never let another woman go through life and not know her lifetime risk of breast cancer and not know what to do with it.
Mm-hmm.
And I swear to you, as traumatic as it was, I never cried after that, ever. I can sit here and talk about my breast cancer. I won't cry, because deep in my heart, I realized this happened to me.
Yep.
And it placed me on this completely different path. The reason I'm sitting here is because it pushed me into this path. I was always a gynecologist. I gave amazing care to my patients. But I feel like now I'm a woman with a mission. And I will not leave this planet until my mission is accomplished. I feel like, you just have to go down that path. Look why you're here. You're here to bring awareness to ovarian cancer. As soon as we messaged you, you're like, yes, I want to talk about this. This is what my wife or Haley wanted me to do.
Mm-hmm.
So I would say open up your heart. It's traumatic, but you learn so much. Just like you, I see the world differently. I have a different level of gratitude. And I feel like until you get diagnosed with cancer, or you have a loved one who's diagnosed with cancer, you don't understand what I'm talking about. That's the sad part of it. You and I can sit here and keep telling people, appreciate your life. Wake up. Don't complain. But it's such a personal journey, and it's so traumatic at so many levels. Last Friday, I haven't told this to anyone, but it was my 5-year anniversary for my breast cancer, and I've had this shoulder pain.
I know.
But listen to this. I had this shoulder pain, and my husband kept, because I went to a party in November, and a chiropractor put a Theragun under my armpit and my shoulder, and I've had double mastectomies. I have a lot of scarring. I started having left shoulder pain immediately. Then I put myself into physical therapy, massage therapy, aggressive therapy. Shoulder pain got worse. On last Thursday, I go for my MRI. They do an MRI. I'm thinking they're going to call me and say, you have arthritis, you have this, you have frozen shoulder. My doctor called me the next day and he said, Thaïs, I need to talk to you. I said, why? He said, you have some inflammation in your joint, but you have a 9-centimeter mass under your left scapula. And I'm like, what? At this point, I want you to understand, you get it. I already have PTSD from my cancer.
Yes.
I tried for 5 years to control my anxiety and fear of dying constantly with this, something deep in your heart says, you might get it again, you might get it again. And I'm like, what is it? They're like, well, it's so big. And it could be sarcoma. It could be your breast cancer coming back. By the way, it turned out to be a desmoid tumor, which is a benign sarcoma. I'm sure you know what it is. I had not heard of a desmoid tumor. They're like, well, I'm sure you know as a physician. I'm like, no, I don't. I've never heard of a desmoid tumor. Wow. Maybe in medical school. It's 1 in a million, and it can start with trauma or surgery, but it's a benign sarcoma. So I'm sitting here listening to you. I'm like, how do you get the strength to do what you guys did?
I appreciate it. I'm glad you said that, because you don't realize how strong you are till it's like the only choice you have. And I say this a lot, I started letting my circumstances reveal to me what it is they're trying to show me and what kind of person I want to be. Embrace what you're going through, your circumstance. And, Haley and I were given this journey for a reason. Mm-hmm. And I asked why a lot. And sometimes I felt like I had an answer, sometimes I didn't. But sitting here being able to tell the story, a lot of great things come from tragedy for some reason. It grabs people's attention to listen. And so, I don't know, I just always look at it, if Haley can go through what she went through, then, I can move forward and put a smile on and be grateful for my life. And that's why I'm so passionate about health. And
thank you, yeah. Thank you so much. I have to say, I think this is going to really bring such awareness. Thank you so much for sharing your story today. It's incredible.
Dr. Taylor, I've been practicing medicine for 23 years, and I've never, ever had a patient of mine die under my care, ever. Now, I've had patients come through the door with advanced stage cancer, but under my care, I have never lost a patient to cancer. Every time I say that, it's not luck. You can't tell me this is luck, because you can't be lucky for 23 years with this many patients, right? One thing I do different is I was trained at County, and at the time we didn't have ultrasound techs. So the residents were forced to do pelvic ultrasounds. So when I came out of residency, I was an extremely good sonographer. I could see the uterus, I could see the ovaries, I could see lesions on the ovary. And this became part of my practice. From the day I opened my private practice in 2002 until now, which is 22 years, I have done an ultrasound on every single patient who walks into my door. I am never surprised, ever, never, ever, with an ovarian mass in a patient of mine who's been under my care. But when you look at the data, they're like, there's no data. My office is your data. 2 years ago, I had a 27-year-old pregnant patient at 14 weeks. I want you to listen to this story. She came to my office with a 2-centimeter ugly left ovarian mass. 2 centimeters. Do you guys know how little that is? That's almost the size of an ovary in a 27-year-old. I did an ultrasound, and I'm like, I don't like this. I sent her to my institution to an oncologist. The oncologist called me and he said, what do you want me to do? Take this woman out at 14 weeks pregnant, take an ovary out that's probably nothing in a 27-year-old? And I replied, yes, if you think it's ugly, then you have to take her, because her life comes before the life of this baby. He said, I'm not going to do it. Send her back to me. The patient came back to my office and said, well, he told me to come back in 8 months, 7 months postpartum. What would you do if I was your daughter? I said, if you were my daughter, I would take you to surgery, outpatient. I'm an extremely good laparoscopic surgeon. I won't touch that uterus. I would take your ovary out if you were my daughter. But I will tell you, I could be wrong, and this ovary could come back completely benign. But if it's precancer or cancer, then I've saved your life. She said, I want to do what you would do for your daughter. I said, then let me take it out. I took it out, and the path report came back pre-malignant. She already had inflammatory changes all over her ovary. I saved this woman's life, right? I've done many of these surgeries in my life. When I posted about this, a radiologist, because I said in my practice, I catch ovarian cancer stage 1, and I can list the number of those patients in my practice, and they're all alive. A radiologist private messaged me. She said, you have to stop lying on Instagram. There is no screening for ovarian cancer. That broke my heart, because as long as physicians think that what I'm doing in my office is not true and it's a big fat lie, then we can never save someone like his wife. It takes me 30 seconds to do a pelvic ultrasound. 30 seconds. I need a probe in the vagina for 30 seconds. Because insurance companies don't pay for it, right? Mm-hmm. Doctors don't get reimbursed for it. A lot of them are not trained to do it. So it's hard when you have to see a patient and send them to a technician. If I had to change things in the GYN field way before they get to you, Dr. Taylor, I would force every single woman to have a pelvic ultrasound every single year. I would force GYN, gynecologists, to learn in their residency how to do a pelvic ultrasound. If you come to my office with an MRI or ultrasound, I shred it. I have to look at your ultrasound myself. 99% of the time, my diagnosis is correct. That's where every gynecologist should be. If you scan every single patient who walks into your door for an annual exam. Now, I'm not saying you can have a normal pelvic ultrasound and 6 months later have an aggressive ovarian cancer. It hasn't happened to me, because when my patients are bloated, I do an ultrasound. When they have pain, they come to my office. My doors are always open to these patients. This should be standard of care. Someone like your wife should not beg for an ultrasound. It should be part of their annual exam. I pick up endometriomas, ovarian cancers, dermoids, fibroids, polyps, uterine septums, didelphys uterus. I diagnose everything. I'm never surprised with my patients. This should be standard of care, number one. Number two, genetic testing. The problem with your wife is she's very, very young. We usually don't do genetic testing in an 18-year-old. It's traumatic. Mm-hmm. What are they going to do with that result? Because even if you have a gene mutation, let's say BRCA, we don't start treatment until they're about 25. So it was extremely unlucky what happened to your wife. But when you do have a first-degree relative, grandma, aunt, sister, daughter, mom with ovarian cancer, insurance will pay for you to do a genetic cancer testing. There are many genetic cancer tests out there. Imagine the surface of the ground. You have every genetic test drills to a certain level into that ground. So some genetic tests are very superficial. They test a lot of diseases superficially. Others go deeper into that DNA to check for a gene mutation. So these are steps we can take to bring awareness to basically inform women to be their own health advocate. My job is to keep women away from Dr. Taylor. By the time they're sitting in her office, they're in trouble.
Yep.
I do the MyRisk genetic test. It's by Mary Alice. If they have a physician order, they can even do the sputum test at home. I do it in my office with blood. This is covered by insurance, but a lot of people don't know that they can do this. They don't know that they have access to it. They think it's extremely expensive. The price of it, if you don't have insurance, it's the best $250 you can spend if you have family history of cancer.
And Haley's grandmother had ovarian cancer. Mm-hmm. So,
but the problem with Haley is she's so young. So you don't do genetic testing in a 15-year-old.
Hearing you say about doing the ultrasound, Haley has been preaching it till she was blue in the face, that should be the standard of care. That's what she wants changed more than anything, is that people can get an ultrasound every time they go.
That's why I haven't lost a single patient. Do you understand?
I couldn't agree with you more. I think that
this is not something, I'm not asking for a CT scan and MRI. I'm asking for a 30-second transvaginal probe. As fast as it takes you to do a pap smear, that's how fast it takes me to quickly look at your ovaries. Do you know how many ovaries I remove? If you have family history of ovarian, you might think, Dr. Taylor, I'm very aggressive. I am. People tell me I'm very aggressive, but my aggressiveness has saved my patients' lives. If you come to my office and your mom died of ovarian cancer, guess what? As soon as you're menopausal, I'm taking those ovaries out. Your genetic test is already done. If you're postmenopausal, I've been following you. Suddenly there's a mass on your ovaries. I take you to OR and I take it out. I don't watch anything after menopause that's possibly growing. But without doing this transvaginal ultrasound, you can't really palpate it on exam. It's impossible to palpate a small ovarian mass. That 27-year-old, and I'd be completely honest because I'm very honest in this podcast, Dr. Taylor. If that ovary that I removed in that 27-year-old was benign, I would have been, we call it peer reviewed, meaning they would have sent me a letter from my institution, and I had to explain myself why I removed an ovary out of a 27-year-old girl who was 14 weeks pregnant. But when it came back pre-malignant, no one talked about it.
I think the key takeaways are definitely one, recognizing when there's any whiff of risk, very low threshold to at least see a genetic counselor or actually get genetic testing. And number two, lowest possible threshold to get a workup, get an ultrasound, imaging, see a doctor, be relentless as you all ultimately were when there's anything that's off and persistent and you know your body. I think body awareness for all gynecologic cancers, whether it's endometrial cancer, where bleeding, abnormal periods, postmenopausal bleeding, those things are not normal. They need to be pursued. Anything that feels different below the belt, those are the cancers that we manage as gynecologic oncologists. Being aware and really just being your best advocate. I think seeing a gynecologic oncologist, see a lot of things that may not be overtly cancer, but ultimately, having patients come in for care and really getting to the bottom of what's going on does save lives.
Thank you guys so much. This is going to save so many women's lives and impact so many people. We're so honored to hear your story. And thank you so much, Dr. Taylor, for everything you do for women. And thank you so much for being on the podcast.
For being so amazing. Every time I'm in trouble, I'm calling her.
I know. Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.